Welcome to Vital Signs, where we talk about all things protection of the greatest asset in your life, your health. I'm Jen Godet, your host, and you are in for a treat. We are going to dive deep into all things heart health, from high blood pressure to everything you need to know to optimize your health with our expert. Dr. Sonbol, owner of a private cardiology practice that specializes in general and interventional cardiology. Welcome to the show.
Hello, Jen. Thanks for having me back.
So, we've had you before. It was excellent. And I've brought you back to talk about high blood pressure. It's more than just a number. It's called the silent killer for a reason. So many of us don't realize that we have hypertension until it's too late. Can you tell me a little bit about how that is and how that comes to be? Why is high blood pressure known as the silent killer and how is it so dangerous for us?
Sure. So, high blood pressure is really, it is more than a number. You're absolutely right. And it is called the silent killer. And I tell my patients that all the time. High blood pressure is one of those things. It's basically, it happens with age. It can be caused by genetics. There are other, medical problems that can lead to high blood pressure, such as diabetes, other sorts of things. And it's really a mechanism in which, just imagine your whole body is full of blood vessels, or so pipes, and these pipes just get kind of stiff, and that raises the blood pressure in your body. And blood pressure a lot of times just doesn't have any symptoms, and people can be walking around with high blood pressure and have no symptoms whatsoever. And their first time they realize they have high blood pressure is, for example, unfortunately, a catastrophic event like a stroke or something that winds up in the hospital. Then you realize they have high blood pressure and need to be treated for it. So it's one of those things that, unless people are getting routine care and seeing a physician on a regular basis, or at least getting an annual physical in which somebody's checking their blood pressure if they don't check it alone at home, sometimes it's never diagnosed until that point.
So let's dive a little bit deeper into there. Talk to me about if we're walking around and we have this silent killer, this high blood pressure, what are the impacts? How is that impacting our heart and our overall health as we're walking around not knowing that we do have hypertension?
Sure. So it's a great question. So, when you have high blood pressure, let's just say your heart is a pump, basically, right? And so that pump has to, anytime you turn the faucet on at home, it has to create a pressure to bring water out of your sink so that you can use it, right? And so the heart is the same mechanism. It pumps blood out of the cavity in the heart to feed the rest of your body with blood. And so as your blood pressure, let's say outside of your heart, is high, then that heart has to generate even more pressure to pump that blood past it. And because of that reason, over time, what can happen is the heart can eventually, get tired and can strain, and that strain over time can lead to several things. It can lead to heart failure. It can lead to heart attacks. It can lead to all sorts of other problems, and not only in the heart itself, but in the rest of your body. So your body's all fed by the same, by blood vessels. And so high blood pressure over time to any organ is never a good thing, because, in the kidneys, for example, it can lead to your kidneys failing. In the brain, it could cause people to have strokes. In other organs, it can cause them to just not perfuse well. So a high pressure doesn't necessarily mean better flow to the body. It actually can be limited flow to the body, because you have to overcome that pressure in order to get the blood to the organ.
And so, talk to me a little bit about some symptoms that we might not normally associate with high blood pressure. Like, what are some things we might feel in our body if we have high blood pressure that maybe we don't associate with it or know to associate with that as a potential cause?
Sure. Another great question. Things like headaches. If you have chronic headaches, that could be a sign of high blood pressure. Visual changes, that could be a sign of high blood pressure. Sometimes people can feel like they have palpitations, their heart's racing for no reason, and that actually sometimes is a sign of high blood pressure. And once you treat the pressure, those palpitation feelings, or those irregular heartbeats, or this feeling of your heart not beating right, goes away. Other things could be, people can feel flushed, they can feel lightheaded, they can feel dizzy. Um, Those are just, sometimes people can get chest pain. Sometimes people actually present with heart failure, meaning they're short of breath all of a sudden, and that's because the pressure got so high outside in their body that their heart just couldn't pump against it, and then all of a sudden blood had to go backwards into the lungs and into the abdomen and etc. And so they're kind of retaining fluid. So feeling short of breath on a regular basis can be a sign of high blood pressure. I think those are a lot of the biggest ones that I can remember.
And a lot of those things we sometimes put off, especially women of a certain age. We feel a lot of those things when we're going through life changes. And so sometimes when we have symptoms, we just say, "Oh, it's just the age that I am, or that's normal." But what I'm hearing and what I really want to emphasize to everybody who's watching is if you have these symptoms regularly, it's not normal. Check it out. It could be something other than what you're guessing. And our health is our greatest asset. We shouldn't be guessing anyway. So let me ask you, we all know that there's medication for lowering blood pressure, but are there any natural ways or things that we could do from a lifestyle standpoint that'll lower our blood pressure?
Sure. I mean, obviously, some people are just genetically predisposed to high blood pressure, and so medication is the only answer. But sometimes, things like weight loss is a very important thing. If you can lose a few pounds, that can actually dramatically decrease your blood pressure over time. Exercise, obviously, is another factor that can decrease your blood pressure over time. Those are probably the biggest two things that I can think of, is really just lifestyle modification. So make sure you're having a healthy diet, make sure you're exercising, make sure you're taking good care of yourself. Those are all things that can really actually have significant impact on blood pressure. And in particular, weight loss, I think, is the biggest one. I mean, I've seen patients who used to have high blood pressure, for example, and then they lose weight, and they actually don't need their blood pressure medication anymore because their blood pressure normalizes. And that's just a factor of that whole pressure system that I'm talking about. So if your body is, if you're really overweight, then your body has to be able to perfuse those organs, and your heart has to compensate for that. And so eventually you get high blood pressure from it. And so once you lose the weight, your body is just able to, adjust to that, and your blood pressure goes back to normal.
It's really fascinating because lifestyle modifications can help with so many chronic disease processes. Maintaining a healthy weight is almost like a panacea for so many of the stress related and lifestyle diseases that we see. So let me ask you the next question because I hear this a lot, and there's a lot of misinformation and disinformation out there on the internet and with gurus and whatnot. And there's people who've been on medication for a while and maybe they've done lifestyle modifications. And so they assume or take themselves off, for example, of a medication without seeing a doctor or asking a doctor how to do that safely first. Can you speak a little to that and educate us on why it's important to make sure you're always meeting with your healthcare practitioner who prescribed that and make sure that it's done in a safe way? Or what should patients ask their doctors before starting or stopping a medication for hypertension?
Sure. I mean, I actually run into that in my practice a lot, and people ask me, do they need to be on their blood pressure medicine still? And it really depends. So if somebody, I've had patients that, for example, say I was on blood pressure medicine, then my blood pressure got better, and I was told to stop it, not realizing that their blood pressure is actually better because they're on the medication. So stopping it doesn't make it, it's only going to make it worse if no lifestyle modifications were in there, or if their blood pressure is high when they come to see me. So one of the ways you can do that is, for example, if somebody comes in and their blood pressure is actually lower than it used to be, and let's say they're symptomatic from that, so they're also lightheaded or dizzy or just kind of feel fatigued, other symptoms that may be related to low blood pressure, and they're on blood pressure medication. Those are the times where I tell patients, maybe it's worth it to either reduce the medication or stop it and track your blood pressures. And so you track your blood pressures over a period of time in order to say, okay, then they don't have high blood pressure anymore, and it's okay for them to be off the medication. The same way when you do treat people for high blood pressure, I mean, I have patients that come into my office all the time. And when you come to my office, I'm at a medical office building attached to a hospital. They got to find a place to park. They got to walk in. They're running behind. and then you check their blood pressure and it's high, because blood pressure is a dynamic thing. When you're stressed, your blood pressure can be up. When you're in a rush, your blood pressure can be up. And so a lot of times I tell my patients, I'd like you to go home, take a log of your blood pressures. Not every second of the day, not 3 times a day, but maybe once or twice a week, sometimes 3 times a week. And I'd like to see you back in a few weeks and look at the log of your blood pressures, because you really want to look at the trend. It's never just one number that you treat based off of, or one number that you stop the medications off of. So a trend is always important. So before you stop your blood pressure medication, have that discussion with your physician, establish a plan of what the trend is going to be and how often you're going to check your blood pressure, and then look at the trend. And if the trend is overall normal and you want to stop the blood pressure medicine, and then again, keep that trend, follow that trend again, and see whether or not the blood pressure stays within normal limits.
That's fantastic. Thank you for educating us. It's so important that we're informed. Folks, Dr. Sonbol is an expert in this space. How can people reach out to you if they'd like to learn more, or if they're maybe looking for a practitioner with your expertise?
Yeah, you can either contact my office at 281-912-3866. We have a website, um, Yassir Sonbol MDPA. We're on Facebook, we're on Instagram. Any one of those ways you can contact us, and we'd be happy to help anytime.
Thank you so much for your expertise. I really appreciate you coming today.
No problem. Thank you for having me.
And we will be right back after these important messages.